enter the room.
Hello,
Hello, doctor.
I'm Dr. Firoz. I'm one of the doctors in the CP surgery. Are you David Pickford?
Yes, that's me, doctor.
Can you confirm your age, please?
I'm 40.
Okay, so is it okay to call you David?
Yeah, David is fine.
Okay, so nice to meet you, David. I understand from my notes that you have this nosebleed. So, can you please tell me more about your nosebleeds?
Yes, actually, I've had it twice now. So my first
Mm-hmm.
episode was some 5 days back, and I
Mm-hmm.
was actually picking my nose at that time. And the second one happened about just yesterday, and it took for it to stop for in like 5 minutes. It took for it 5 minutes to stop. So I'm not sure what's happening. Can you give me a little idea about how I can prevent this?
Yeah, definitely. We should be able to help you with that. Before that, I'd like to ask you more questions to understand better about this nose bleeding. So, you mentioned to me you have these two episodes of nose bleeding. So, how long each episode lasts for?
Well, the first one wasn't long. I was pinching my nose really hard, so it stopped almost, in a few minutes. But the second time, it just started on its own, and it took for it to stop in like 5 minutes. And yeah, I'm getting a little worried. Why is it happening on its own now?
Okay, I understand. It must be difficult. So, is there anything that makes your nose bleed better, or you need to take anything?
I'm not sure. It's just happened the two times, and I think
Mm-hmm.
it's just
Okay.
continuously getting worse.
Okay.
I don't even know
Okay.
why it's
So.
happening.
Okay. So about the last episode, that time did you pick like speaking that time also?
No, no, I wasn't doing anything. Like I said, it just happened on its own spontaneously.
Okay. And any chance by any chance is there any recent trauma to your nose?
No, doctor. It's just that the first time while I was picking my nose, that's when the bleeding started. But
Mm-hmm.
this time there was nothing. It just happened on its own.
Mm-hmm. Okay. So I understand from my notes that you have this deep vein thrombosis. So can you please tell me about this deep vein thrombosis? How long you have been diagnosed with that?
Well, I had it like 3 years back, and
Mm-hmm.
immediately after that, I developed this pulmonary embolism. So
Mm-hmm.
now it's all better, doctor.
So
I
are
was
you on
actually on
any
this normal
medication?
flight, and that's when it all started.
Okay, so do you have any pain or swelling over your leg?
No, doctor, I'm absolutely fine.
Okay, and any redness or any discharge?
No, doctor, nothing. I'm absolutely fine.
So for this different thrombosis, are you taking any kind of medication?
Yes, I'm on a Pixaban.
So are you taking the medication regularly?
Yes, I am. Yeah, as it's prescribed.
Okay. And did you travel recently to anywhere?
No, no, I have not.
Mhm. Do you have any symptoms like vomiting?
No, nothing like that.
Do you have any weakness in your body?
No, doctor.
Or do you feel drowsy?
No, doctor.
hmm Okay. And okay, so apart from this deep vein thrombosis, do you have any other medical condition?
No, doctor.
Okay. So anyone in your family having any kind of bleeding disorder?
No, doctor, not that I know of.
Okay. So what do you do for the living?
I'm actually a bank manager.
Okay. Now I'm going to ask you some personal question. It's important for our this consultation. So do you smoke?
No, doctor, I don't.
Mhm. Do you drink alcohol?
No, doctor.
Okay. So, David, do you have any idea what might be the cause of this nose bleeding?
I'm not sure really.
Mhm. So, and are you concerned about anything particularly?
Yeah, I'm wondering what this is. I mean, how is this happening? And how can I make it stop?
Yeah, okay. We'll look into it. Okay. Okay, so David, thank you for answering my question.
Mm-hmm.
And now I'd like to check your blood pressure, your pulse, your temperature, and your respiratory rate. Okay. Now
Okay.
I'd also like to check your nasal cavity and eye and throat. Okay.
Mm.
Okay. Okay. So David, from what you have said and after examination, I think
2 minutes remaining.
okay. So it seems like that you are taking this apixaban medication, and
Mm-hmm.
you are having this spontaneous nosebleed because
Mm-hmm.
of this apixaban.
Yeah, that's okay. I see.
hmm Because sometimes if we are taking any kind of blood thinner medication, that may increase the chances of developing any kind of bruises in the body or any kind of bleeding tendency. Okay,
I
so
see. So, what do you suggest I stop the medicine?
okay, I am not about this. First, I think I'll will send you to the for the specialist. Okay, they will check everything, and after
Mm-hmm.
that, if necessary, they will stop it or maybe they will put you in another medication. Okay, will refer you for this.
I
And
see.
as now I didn't check any bleeding spot, so I'll give you this Nosebleed cream, so you can apply over there. So for the 5 days, how does that sound to you?
Yeah, that's all right. But what does this cream do?
Yeah, so it will improve this if there is a bleeding point. It will help to reduce the chances of bleeding. Okay.
Mm-hmm. I see.
And please make sure that if you again further you develop any kind of bleeding and
Mm-hmm.
it's not stopping by itself, or if you hit your head or any kind if you fall down, please come back to the emergency. And I would also like to make a follow up after 2 weeks after consulting with the seniors.
Mm-hmm.
Okay,
Yeah. All
so
right.
okay, do you have any other concern?
No, doctor, I was.
Move on to the next station.
All right, good job. Yes, so this is the case of apixaban. So apixaban, as you know, is a blood thinner. And the couple of things
Hmm.
that you need to understand is there bleeding from anywhere else? So you asked
Yes.
a lot of questions about how long have you been having this nosebleed, how many episodes, how much blood, those are the important questions because you understand that there is bleeding and you think it's related to apixaban. So you need to
Yeah,
understand.
I didn't ask about that gum bleeding or easy bruising or these things. Okay.
Exactly. Because the main thing you need to understand is where all is he bleeding from. So so nosebleed is actually considered a mild risk, right? And
Okay.
especially he had trauma. So there is an
Okay.
area
Yeah.
called the Little's area in the nose. So that's like a plexus of a lot of vessels. So he went and picked his nose. It started bleeding. It's a very potential spot to start bleeding. So if you put a little bit pressure, also it will bleed. And on top of that, you're on anticoagulant. So you should say that since you've had a past trauma already, there is, and since nose is a very susceptible place for bleeding, there are chances for you to bleed. This is a mild consequence of being on this medication, right?
Okay.
However, if you find bleeding like in your urine or if you are bruising easily, these are times when you have to get worried, right? At this point, since this is a mild consequence, I can give you some strategies to stop the bleeding. You were right, pinch your nose and keep it. Pinch your nose and lean forward Because if there is bleeding, you don't want it to go into your nasal tract. That can actually cause asphyxiation.
Yeah.
Right? It can go to the wrong pipe. Right? It's just going straight into the windpipe. You don't want anything to go. So you're telling them to lean forward
Yeah.
and pinch the nose. If the bleeding is persistent for more than 10 minutes, please come back. That's very bad.
Okay.
Right? Then it's not at all clotting. Yeah, because this is a
Okay.
5-minute bleed. You understand it's not that bad. But if it's 10 minutes or more, it's pretty bad. Yeah, these are things that you have to keep in mind for a
Yeah.
Pixaban. You asked about DVT.
Okay.
Very good. You did you should have done a little bit of a calf examination and all that. So, data gathering, I would say, was good.
Yeah.
Let's just look at the examiner's checklist. All right. Yeah, associated
Yeah,
with
cough. Yeah, that
yeah.
in pulmonary embolism symptom, I forgot to ask.
Yeah, is any so you asked about DVT, it's good enough, right? So you've understood that there is a disease for which you're getting medications. Is the disease properly handled? So you need to ask the symptoms of the
Okay.
disease. Is the disease still there? So you understand that the disease is not there. All right, now you're going on to the medication. Now the medication that you're taking, what all are the side effects? Mainly it's a blood thinner. So you know that it's all the clotting problems. Right?
Yeah.
So easy bruising, gum bleeding, any hematuria, that's when you should be concerned. Right?
Okay.
All right. So medications, confirm apixaban dosage, check if there is possible overdose. How have you been taking your medicines? That's important.
Yeah.
Right? How are you prescribed and how are you
Dose
taking?
and this. Yeah.
Yeah, because that's what you need to understand, that how was he prescribed? Is he taking the right dose? Is he taking more than what is required? Is it because of that he's bleeding? You know it's because you feel that it's because of the apixaban, but is he taking the apixaban properly?
Yeah.
You need to confirm that, right? Before you jump into the conclusion that it's because of the apixaban, we can dose adjust. What if he's not taking the right dose? What if he feels that he needs to take more so that it doesn't happen again? Because this can.
Yeah.
So there is a case of what you say, rivaroxaban learning disability. Over
Yeah.
there, the patient is not taking it properly at all. So you need to understand everything about how they're taking the medication, what were they prescribed. Most of the times in those stations, they'll tell you how they were prescribed the medicines. So you should just ask them, how are you taking? Can you just please explain it to me so that I can understand how you're taking the medicines? Right? But this is an important question here also, because you need to understand if he's not over medicating himself in order to feel the side effects.
Yeah.
And then trauma check that you did, blood disorders in the family, none, yes. ICE, you started with ideas. What do you think it is? Particular concerns. What do you expect out of this consultation? These are open-ended questions which really work, right? I told you about the power of open-ended questions. So, whichever question, it's like it's like those video games where you try to hit the right spots. One spot when you hit, you get like a lot of coins out. When you hit
Yeah.
another spot, you just get one coin out. Open-ended questions are those coin draining questions that you have, because once you
Okay.
understand that the patient is talking a lot, you've hit jackpot. Because you don't want to
Okay.
be talking much. Trust me, in these exams, you shouldn't be hearing your voice. You should be hearing their voice. If they
Okay.
are giving you information, then you know you've hit jackpot. Definitely. Like, how are you feeling? Or what do you think it is? Do you have any concerns that you want to share with me? And they'll start, because if they are giving you their concern, that means they are literally reading out the script for you. You have hit the
Okay.
right points. If they're giving you information, that's good for you. Just listen to them and understand, all right, I have these many points, I have this. What else do I have to ask? Yeah.
Okay.
So just remember that if they are talking, it's really good for you. All right. So ICE is a very important question. You did the examination, ENT examination, because it's a nose thing, and look for bruises, any signs of bruises. And since he had pulmonary examination, I mean pulmonary embolism and DVT, cough examination, and respiratory rate and all that. You got that, and you can also do blood test. So even though so apixaban is anticoagulant which inhibit factor 10A. So 10A is actually for both for the external and intrinsic factors, external factors and the intrinsic factors both. So the external factors mainly you have PT for that, and the intrinsic factors you have APTT for that, and both you can
Okay.
check. And 10A helps in both. It's in the common pathway. So
Okay.
you can check for APTT and
Yeah.
PT. So INR is actually a standardized PT. It's international, what is normalized units.
International ratio. Yeah.
Yeah. So international normalized ratio. So basically, it is basically a fancy PT with some standardized,
Okay.
denominator, right? So you can do all these tests. Even
Okay.
though the most comprehensive test would be the factor 10A assay, but you can do all these tests just to understand if there is a clotting problem at all, right?
Okay.
And also do LFT and RFT, because these are important medications. If over medicated, these will take
Yeah.
a hit, right? So you can just do all that. All right. And first aid, exactly what do you need to tell, like what should you do if this happens again? This is a very important
Yeah.
question. Like, what happens, what do I do if I, so this is a safety netting that you have to give them. If this happens again, this is a consequence of your medication most probably, and it might actually happen again. So what should you do? Apply pressure, move
Okay.
forward, lean forward, right? Sit up, lean forward, and pinch your nose, and soft part of your nose for 5 to 10 minutes. Apply ice pack, like that's also vasoconstricting. And medication, Naseptin is actually antiseptic, just so that there is an opening, so there is a breach in the skin. So that's why you're just giving them the antiseptic just in case
Okay.
they don't have any. Yeah, because it's a very high blood supply area, the littles area in the nose. So you just have to make sure that there's no infection that goes in, because it's kind of like the dangerous
Okay.
area of the face. As soon as it goes to the
Yeah.
nose, it can go up to the brain.
This cavernous sinus something. I don't forgot. Yeah.
So you have to protect the dangerous areas, like you can't risk it, and especially for a very highly vascular area like that. Yeah. And safety netting, if the bleeding lasts for more than 10 minutes, if you start feeling difficulty in breathing, large if you swallow large amounts of blood, if you have any weakness, dizziness, then there are losing blood. So two
Yeah.
things you have to safety net for: if there are any symptoms of pulmonary embolism or DVT, if you feel that you are feeling like that again, or if there is any side effects of the medication, like any bleeding, easy bruising, or any major bleedings that you've had, any hematuria. Yeah. Follow up review in a month.
Okay.
You should definitely ask him to follow up. Yeah, we will review your medications, we'll do some tests and review your medications. And leaflets and pamphlets is also something that you can give. And yeah,
Okay.
everything else was great. The other one was urgent concern, contact information and urgent concerns. Yeah, that's very important, because he's on a medication, that too a life-threatening medication. If taken wrong, it can cause a
Okay.
lot of problems, right? So you need to give him the emergency contact just in case if you do feel this. Make sure all that.
Okay.
Okay.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.